Good day, people. We're here to talk about two things. We're here to do a very basic talk about planes of motion and what they actually look like in the body. We're also here to speak about basic control of planes, which we will demonstrate after this little talk. So the first thing to start this little talk with, again, it's about basics, is there's two general types of motion. Now, I am not a physicist, I'm not a mathematician, so I am not the best person to explain this. However, I have enough of a hold on the concept that I can give it the basic description. If you want more, you can go out and use the wonderful world of the internet and look this stuff up and get a deeper explanation if you don't already understand it. So first, there's two types of motion. There's essentially, and there's really more, but for our purposes there's two. There's translational movement, which is essentially motion in a straight line with respect to its fixed point, or motion with respect to a fixed point that does not change its orientation with respect to that fixed point. So if I have a fixed point here, the motion is going to essentially be a straight line. Okay, so translation can also be described as motion in a straight line. There's also rotational motion. So rotational motion is motion about that fixed point where the orientation changes with respect to the fixed point. Now, in the human body, there are very, very few examples of actual translation. Translation can be achieved by the hand, although there is rotation involved, because there's rotation, say, at the shoulder, there's rotation at the elbow, there's rotation at the wrist. It can technically be achieved by the hand, it can be achieved by the foot, but not as easily just because of the way the leg ends up moving, but it can be achieved by the foot, but again, there's rotation at other points. It can also essentially be achieved by the scapula, just because of the nature of the scapula, the way that it interacts with the actual thorax, that it's mostly connected by muscle, so those muscles will allow essentially a glide plane. Okay, so we have your two basic types of motion, rotational motion and translational motion. So again, those are very basic things, and you can look that up more. My explanation is not going to be perfect, it's not going to be as complete as it could be, but that's the basic grounding so that we can move on. Now when we move on, we look at the human body. The majority of motion in the human body, as we already said, is rotational, right? So it's movement about a fixed point where the orientation changes with respect to that fixed point. So ulnar and radial deviation is essentially a rotation because the motion that's occurring changes orientation with respect to whatever fixed point we want to talk about. So when we're speaking about it, we need to understand that to orient ourselves with respect to planes of motion, that different terms are used to orient ourselves. Now, these terms are not perfect with respect to describing motion accurately, but they help us orient ourselves. So we have three primary planes. We have the sagittal plane, which essentially cuts the body right down the middle, left and right halves. Okay? We have the coronal plane, which cuts the body in the middle, straight down the middle, front and back, so front half and back half. And we have the transverse plane, which essentially you could put anywhere and it would cut the body in half, top and bottom. Okay? So with respect to each of these planes, we have different terms to describe motion. Now, with respect to the sagittal plane, okay, the plane where we cut the body in half left and right, we have what would be called flexion and extension, or forward bending and backward bending. Now, we also need to just make a brief mention of axis. The axis of motion is perpendicular, aka at 90 degrees, to the plane of motion. So the plane is going one direction, the axis is perpendicular to it. So in the sagittal plane, cutting my body in half left to right, the axis would be considered a transverse axis, because the axis could, if it was able to cut me in half, cut me in top and bottom. Okay, so transverse plane, transverse axis would cut the body in half top to bottom. So sagittal plane, transverse axis. So if we look at this, what we get is rotation forwards, rotation backwards. But to distinguish it from rotation in other planes, we will call it flexion, or bending towards the front of the body, or extension. Okay? So just our basic terms. Now we look at the coronal plane, where we've cut the body in half, front to back. Okay? So the plane is going to cut us in half, front to back. The axis will be perpendicular to it, so it would be essentially coming straight from the front of my body to the back of my body. Okay? You could talk about that in the transverse plane. That gets confusing, so what we end up doing is we end up giving you another way to understand that, and we call it an anterior to posterior axis, or a posterior to anterior axis. So an axis that is perpendicular to the coronal plane, that goes from the front of the body to the back of the body, or the back of the body to the front of the body, depending on how you want to describe it. What that does is it gives us our axis and allows for rotation to the left or to the right. Okay? And we would call that side bending, or lateral flexion, so bending to the right, bending to the left, whichever way you would like to speak about. Now we talk about the transverse plane. Okay, we've cut the body in half from top to bottom, so the axis being perpendicular, it's going to be considered a vertical axis. Okay, so you could call it maybe a sagittal axis, but that gets confusing. So based on words, because you would think sagittal axis, you could get confused with sagittal plane, and I might be doing it to you right now, and if so, I apologize. You can always rewind, or you can go to another resource and look this up, and maybe those words hit you better. But essentially we have the axis going straight up and down, so the rotation would be to the left and to the right. So we call it axial rotation. This is the only motion in the body that is commonly termed a rotation, because we can rotate to the right and to the left, or to the left and to the right as I did, and the axis is the vertical axis. So we need that general grounding, that general understanding to begin a conversation about how we actually interact with our patient to create motions in those primary planes, so the sagittal plane, the coronal plane, and the transverse plane, as far as how to actually control those and keep them safe and be accurate with them. So what we're going to do from here, so we've got that basic description. Hopefully it does it some justice, and again, if it doesn't, you can always look it up somewhere else. There's plenty of resources that explain it in different ways so that maybe you understand, because not everybody understands the same thing from the same description the same way, and that's fine. But moving on from that, what we're looking at is our basic control of planes. So the basic control of the sagittal plane, the easiest way to describe this, and this isn't always perfect, but it's the basic way, is that what we would do is we would create a force as a practitioner from the front to the back of the body, or the back to the front of the body, on the midline. Okay, so remember that the sagittal plane cuts the body in left and right halves. So what we would do is we would push straight down the midline, and we can engage motion in the sagittal plane. Okay? To create motion as a practitioner in the coronal plane, again the coronal plane cutting us in half front to back, we could put motion essentially in the line of the axis, right? We could put motion straight across the body, right? And that's, that's a poor way to explain it, not necessarily in line with the axis, but to work with the coronal plane, force straight across the body, okay? Perpendicular to the body wall. So if I push myself that way, then I would tip to the left or to the right. And we'll describe and demonstrate this shortly. Now that AP-PA force, or anterior to posterior to anterior force that we talked about to engage the sagittal plane that was on the midline, if we take that same force and we put it off of the midline, so posterior to anterior or anterior to posterior, and create that motion as the practitioner, then what we would do is essentially create a rotation, or as it's termed commonly within anatomy, a rotation, but really motion in the transverse plane, so motion about the vertical axis in the transverse plane. So hopefully I haven't stumbled over my words too much here and made this confusing. Hopefully I've made it clear. So just to recap, motion in the sagittal plane as a practitioner, the very basic control. I want to create a posterior to anterior or anterior to posterior force, generally speaking on the midline of the patient. If I want to create motion in the coronal plane, I want to create a force straight across the body wall, right, from one side to the other. If I want to create motion in the transverse plane, what I would do is I would take that same AP or PA force I would use in the sagittal plane, I would put it off of the midline, and I would be able to engage motion in the transverse plane. So what we're going to do is we're going to take a break here, and we're going to move on to demonstrate this concept for you so that you can see it with the patient. So here we are talking about the first, or giving the first visual example of basic control of planes with the patient. Now, our patient's seated, and I'm doing this handheld on purpose to just show certain things that I might not be able to show otherwise. So we're going to talk about an AP or PA force, so an anterior to posterior or a posterior to anterior force. So in this case, it'll be a posterior to anterior force on the midline. So I go ahead and I put my hand right on the midline, and I push the patient forward. Okay, and as long as the patient's compliant and it's all safe, patient goes in the sagittal plane. So come on back up. Okay, now I take my same hand and I take it off the midline, and I create a posterior to anterior force, and it's not as visible, but the patient's going to rotate, relatively speaking. It's not the easiest thing to do based on the way that I'm shooting this, but that's what we're talking about. Same posterior to anterior force, off of midline is going to engage the transverse plane. It's not perfect here just because of the way I'm shooting this. Now, if I go ahead and I create a force across the body wall, as we were talking about, the patient's going to side bend. It's not perfectly visible, but you should be getting the general idea. And I'll show this in another visual example. I'll set the camera up in a different way in a moment, just so you can see this. But we have a force across the body wall from one side to the other, and we get the patient essentially to side bend. So here we are, just another visual example with respect to basic control of planes. This is best shown in totality and seated because the patient is the freest to move. So we go back to we look forward to the next series of videos where we talk about concepts of patient positioning, and the first concept being the table makes stable, right? So we talk about the table makes stable, and when you get to those videos, you'll understand it better. When a patient's in seated, they're the least stable, right? So it's the easiest for me to display these movements. So if I go ahead and I create a posterior to anterior force, my hand on the patient's midline, I create a posterior to anterior force, they forward bend. Okay? I engage the sagittal plane. This is very, very basic and straightforward, and I get that. Okay? We take that same posterior to anterior force, we move it off of midline. We're going to create relative rotation. Relative rotation. We're going to work in the transverse plane. And because of how we're shooting this, it's not perfect. If I wanted to do that a different way, I can bring my hand over and I can create essentially, although I'm behind the patient, an anterior to posterior force and a posterior to anterior force with the other hand, and I can create that rotation in a more clean fashion, right? Just for the sake of visualization. Okay. Now, if I go ahead and I come over here, and the reason I'm going to come over here is so that it's visible in one way. Okay. I'm going to create force across the patient, okay, so across the body wall, and we're going to engage the coronal plane, side bending. Okay. The same idea I could do, and hopefully this visualizes appropriately. I can do it from this way. I push, you can see my elbow. I'm going to push straight across the patient, and he's going to tip away. He's going to be moving in the coronal plane. Okay, so that's the second visualization, just to make it a little bit more complete so that hopefully you understand the basic control of planes.